Yes, so this is definitely not a lighthearted subject, but we felt it was really important to kind of dedicate a little segment, or not a little, this is going to be a long segment, but dedicate a segment talking about everything going on with coronavirus. So, as you all very well know, coronavirus is still here and still spreading as much as ever. As of this recording, there's been more than 6.22 million cases in America alone, with more than 188,000 deaths. Just California has had more than 732,000 cases, and cases are on the rise in 26 different states. Just this week, kind of in like public figures that have gotten coronavirus, Dwayne "The Rock" Johnson, his wife Lauren, and their two young daughters, they're like 2 and 4 years old, tested positive for coronavirus. They contracted the virus from family friends, which is what he said in a video. And I think this just serves as a reminder for everyone that if The Rock can get it, literally this strong human like man, anyone can get it and you can be affected by it too. And it doesn't matter if you're just seeing people here and there. It's a virus. That doesn't matter to a virus, and you're just as susceptible to getting it as people who you imagine are like going out and going to parties. Like if you're just seeing like two family friends, like you can still get it. Robert Pattinson also tested positive just days after they resumed production for Batman, which means they had to stop everything again during their production. And I think it's really important to share this information constantly because our government is kind of telling us that everything's getting better by allowing schools and restaurants and gyms to open back up when that's not the case. So according to top health officials, more than 410,000 Americans could die from coronavirus by January 1st, 2021, which would more than double the current death toll. I hear so much conversation, especially on Twitter, that we just need to get to 2021. Like, this is all 2020's problem. We just need to get there and it'll all be okay. Yeah, but the reality is, if action doesn't happen, we're only going to continue to see people die who would not have died otherwise. And that death toll that they're projecting is if we're still taking the precautions that are currently being taken. They were saying
taking it seriously.
Yeah, no one's taking it seriously. I mean, they were saying if we literally stopped doing everything and just resumed quote-unquote normal life, we would be at well over 600,000 deaths by end of the year. So this is even with the precautions that we're taking currently. And this is just a side note, and I refuse to honestly entertain it any further than this because it's so outrageous, but any conspiracy you heard about the 6% is false. Every single COVID death that has happened has been because of COVID. Just because someone is older or has underlying conditions does not mean that they deserve to die or that they died from any condition that they may have had. This means if they got COVID, they got it, and complete negligence from our country is what killed them. They would not have died if they didn't have it otherwise. So, according to the University of Washington's Institute for Health Metrics and Evaluation, near universal mask use would cut the number of projected fatalities by more than half. Let me repeat that. Mask use would cut the number of fatalities by more than half.
Wow.
I know I saw a statistic like a month or two ago that was saying if just 80% of Americans wore masks, like, we would not be where we are now.
Can we just talk really quickly about people wearing a mask?
Mm-hmm.
It is like actually... It really gets me upset. It really gets me started when people don't wear a mask. And it's really frustrating as a millennial, Gen Zer, the cusp, as I think we both are.
The cusp, yeah.
It's just really frustrating to go on Instagram and to see that 80% of the people on Instagram that I follow are posting pictures of themselves going out and doing all these things.
Mm-hmm.
And it's just so annoying because I literally saw a friend from middle school with a celebrity that I know go on a boat on a weekend. And the boat was like a pretty small boat. It had like 20 to 25 people on there. They were sitting on top of each other partying. Like, what?
So ridiculous.
And they were, of course, all under 30. Like, super young, just like living their best life over the summer. It's like, you're not supposed to be living your best life. Like, coronavirus is affecting every single person in the world. And like, boo-hoo. I'm sorry that one summer of your life you have to kind of stay indoors. Like, I'm sorry if you don't have a pool. I don't have a pool. Deal with it. Like, it's just so frustrating. And the people that refuse to wear masks because they think this is just a lie, it's just also very frustrating. And they're so selfish. And it's just super hard to understand. Like, I'm sorry that wearing a mask is inconvenient to you, but people getting COVID and dying is not okay.
Totally. I mean, it's just a lack of I don't know if it's a lack of like understanding the gravity of which like what's going on is going to affect literally like it's like the butterfly effect. Like your actions are going to direct like other actions. It's like I read this story. This was I don't know, maybe a month or two ago. My whole gauge now when I say time is like a month or two ago because I'm like everything's the same. But some woman was talking about on Twitter, I think she's a comedian, I'm sorry I don't know her name at the moment, but she had tweeted that her mother died from COVID and her mother was living in a nursing home. She was living in the nursing home because this was supposed to keep her safe, and she believed because of the time kind of like how the time went, that how her mother got it was probably from someone going out during Memorial Day weekend back in May and kind of like spreading it to someone who like either was working at the nursing home or like was related to someone working at the nursing home or a visitor, something like that, and ended up spreading to her mother in the nursing home who's vulnerable and ended up dying. And it's just like you don't like your actions are directly affecting other people, and I don't know I don't know how to like emphasize that more.
Yeah.
It's so ridiculous. And that's the thing. I mean, I put that in my notes. I think we imagine the people who aren't wearing face masks are like your typical Karen, like just showing up to a store without a mask, which true, yes, that's those people. But we have to think about the people who are hanging out in groups, who are going to parties, or who are even going to restaurants with people not in their household. I mean, you're sitting at this small table with no masks on, with people not in your household. And the study is talking about you guys too. So Dr. Anthony Fauci, who's the country's leading infectious disease expert, said that we're still knee deep in the first wave of the virus. So what's our future? I will say this is honestly such a scary question for me that keeps me up at night. I mean, we've learned that this virus can have any number of effects on someone. Some people can be asymptomatic, not very many. Some people are out of breath for a couple of weeks. Like, I mean, I know people my age who have gotten it and shared on Instagram, and they said they couldn't go from their bed to the kitchen without being out of breath. So even young people are obviously being very affected. But that's a symptom too. There's people losing their sense of taste and smell, which is obviously a neurological side effect. And they also can experience memory loss for like months to come after having the coronavirus.
Someone who has COVID and they lost their taste and smell, and it's so terrifying.
It's so scary. I mean, that's the thing. It's like everyone thinks, or not everyone, but there's this misconception that it's just a flu or just like whatever, just a cough. But it's like you don't know how this virus is going to affect you.
Exactly. And it's such a young virus, and it's changing so much that you're so right. Like, yeah, you might be fine, but a year or two, you might still be having lingering side effects from it. And also, I think a lot of people our age just think like, oh, I'm not going to die from it because I'm young and I'm healthy. Like, it's going to be great. But it's like, yeah, but getting COVID sucks. Like, whether you're 50, 20, 25, 80, it sucks. It really sucks. So, yeah, you're going to live. Maybe. You could also, even if you're young, like, you could still die from this. I want to make that very clear.
Oh,
you're not immune from it if you're young and you're going to get it. Like, no, you could still die. There's been plenty of young people, healthy young people that have died from this. But when you have COVID, thankfully we've never had it, but like when you get it, it really does suck. It feels like, I can't obviously describe it because I have never had it, but it's just like, just saying like, oh, it's not going to kill me. So like, whatever, I don't care if I get COVID. Like, that's also very selfish.
Totally. And that's the thing too. It's, 100%. And that's the weird like logic surrounding this. 'Cause it's like, okay, maybe you might not die. Like, maybe you might not. You don't know, but maybe you might not. But you don't know the lasting effects, like you were saying, that it will have. I mean, I was networking with this woman, so I had a tweet, whatever, about unemployment, and we had ended up like having a conversation over the phone. And I remember like we had to reschedule a week later because she was like, I'm sorry, I took the week off because I had COVID like 3 months ago, and I was so like, I couldn't get out of bed. I was so exhausted. And this is someone in their, I think they're around 30, someone in their late 20s, maybe early 30s. She could like literally had to reschedule a phone conversation, had to take time off work 3 months after getting the virus because she did not feel well. It's like, you don't know. You really don't know. Please, 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 like everyone, I hope you are all aware of that. So we've also learned that herd immunity without a vaccine isn't going to cut it because people can get the virus more than once. We've learned that the only thing we can do as individuals is stay home, and when we do go out, wear our masks. But it's just like so many people aren't following this. So basically, we really need a vaccine. In the US, there's currently 2 ongoing clinical trials of vaccines with more than 30,000 participants. According to Dr. Fauci, the data is looking good. However, Trump has pushed for a vaccine to be made available by the end of October or just before the presidential election. And scientists and public health officials are expressing a lot of concern over this, quote, political arm twisting from the Trump administration. However, pharmaceutical companies have made a pledge to not release any vaccines that do not follow rigorous efficacy and safety standards. So, I mean, as I said, I was talking about this last night. Actually, I might have said it before the recording, but I was just talking about this last night. Like, what do you kind of see for the future? I mean, obviously, we're not experts. We're just discussing this, but because, like, I'm just like, okay, if we all have, you know, vaccines at a certain point, or not everyone will take them, I'm sure, but if we have vaccines made available, I mean, do you think life will ever kind of go back to how it was? Like, is handshaking still gonna ever be a thing? Like, you know what I mean? Like, what do you see?
That's like, I feel like that's in a way such a loaded question.
Totally.
It's really hard to think of the future. I don't think we're going to go back to normal life for a very long time, like maybe 2 or 3 years, if ever. I think a lot of the things, because that we've had to learn because of COVID or relearn, like washing our hands every time we touch something, stuff like that. Like, I mean, for example, like I always wash my hands, but after like going to the bathroom, after like touching something, like, you know, like I wouldn't wash it so rigorously. And I feel like that's something I'm going to keep up. I love hugs. And I just like, I don't know if it's because I'm like Latin or because I just love like hugs. I know you don't like hugs. She hates people.
You are a hugger.
I was a hugger. And so I'm not going to be a hugger after COVID. I don't think things are going to go back to normal for a while. I feel like people are going to be living on edge. At least the people that have really been taking this seriously, I think they're going to be living on edge. I feel like the government, local and federal government, are kind of in this place where they're just like, look, if we continue to close things down, the economy is going to suck. And I think Americans sometimes forget that our economy literally controls the world. So just because, like, if we're doing bad, like, everyone else is doing bad, and obviously politicians understand this. So I think that could be part of the reason they opened everything. And, you know, Trump also had been saying, like, the economy's been great since he was president, so that obviously doesn't look good for him. So I think that's part of the reason they open things. And unfortunately, I don't see them ever shutting everything down completely unless it's like a really drastic second wave. As far as like, I feel like things are going to stay kind of how they are right now for a while, with like some people living in fear, some people taking it seriously, some people not caring. And I feel like we're going to have this COVID situation, maybe, I don't want to be negative, but like until 2022 if people don't get their shit together.
Yeah, I know. I'm like trying to imagine a scenario in which this will go away in a year. And I don't see that. Yeah. I think yeah, well into 2022, I think, God, I don't know. It's scary. It's really, I'm not going to lie, I'm scared. But
yeah,
I think the best thing we can do is, taking our own personal precautions. I mean, wearing masks, we know how important that is. And I mean, like, the thing is, like, going to restaurants, I get wanting to support a restaurant. Why not just do takeout? What's really the difference? Like, pick it up. Like, leave a hefty tip, as you should be doing if you're doing takeout. Like, I know some people are like, I know people don't do that. Make sure you're tipping all the time. But like, it's just like, there's so many different steps you can do. And the fact that people aren't doing those is just, I think, a reflection of, honestly, the government response. And people are seeing like, okay, it's okay for me to go out. I mean, Trump and Pence are together with all their workers all the time. Like, we're not seeing them social distance. We're not really, I mean, Trump wore a mask for the first time like a month ago. Like, it's just like, it's frustrating.
And at the RNC last week, there was that like hundreds of people there, like listening to his speech, and most of them weren't wearing a mask, and most of them weren't social distancing. You can find the video online. Like I do agree with you in that point. Like I do put the blame on some people, and I think I do get really frustrated because when you're taking this seriously, and I live with my parents, my mom has asthma, so she's very paranoid about COVID because she already has a hard time breathing. So if she got it, it would just be so difficult for her, which I totally understand. But like, it's really frustrating when you're taking it seriously and you're quarantining. You're not really going out unless it's for an essential, or you're seeing friends, but it's like the same group of friends that you also know stay home and are taking it equally seriously. It's frustrating when you see everybody go out and have fun because you're just like, this isn't fair. Yeah. Like, why aren't you getting COVID? Like, I don't want you to get it, but it's like, this isn't fair. And I unfortunately, like, I do kind of look at them and am kind of hard on them, but at the same time, when the government is reopening gyms, when they're reopening restaurants, they're opening beaches and parks, they're telling people it's okay to go out because COVID's better. Yeah. So they believe it, and they go out. Even if they're taking precautions, which some people are, they still do it because they're listening to the government. But the government, sure, things are getting better to them, but also they need to make money. They need to make sure the economy doesn't go to shit. Yeah. So there's just so many variables.
I agree. And I think that's something that, I mean, like, I think we're lucky that we kind of have that discernment, but it's just like, I don't know. Like, I wonder the average person, like, who maybe doesn't consume news as much as we do, like, what are they thinking right now? And all I can think of is, I mean, our what's it called? Like, our alumnus, whatever, we're alumni of San Diego State University, and they brought back people into the dorms. They told people come back. They had 200 in-person classes, and now we just found, I mean, they've been getting coronavirus cases kind of, like, they were at 40, but yet just yesterday they announced 120 new cases. And think about it, like, San Diego County as a whole, like, the past few weeks has kind of been seeing an average of around 250. That's 120 new cases just at San Diego State University in their community. So it's just like, yes, you can blame students and say, well, you guys are partying, you guys are having study groups, like, that's gonna spread it too. It's just like, how can we blame the students when the university is bringing them to come back in and come back to these in-person classes? Like, how would they know better if that's what's being told to them? And I think that's just a small example of kind of what's happening in America, and it's just so frustrating to see. It's so frustrating because I agree with you. Where I live, I need to be careful because I live with my mom and sister who both could be at risk. And it's just like, it's just so frustrating.
Just don't be selfish. Wear a mask.
Yeah, please wear a mask. My mustache is sweating because of that rant.
And that's the tea.
That is, wear a mask. Stay home, you guys.